Hi, everyone. I hope everyone is doing well. I know this is difficult trying to, especially these labs, trying to do these online. And so, again, today is the 16th, 16th of April, and our governor, John Bell Edwards, gave a press conference this afternoon. And in that press conference, he talked about reopening on a as yet unknown limited basis the state. We won't know everything right now, but it's looking as though the country will somewhat reopen come May the 1st in what we think is going to be a limited capacity. Now, it appears right now as though BIPSI will have and does have right now, and again, today is Thursday the 16th, and if you need to register for classes, if you have relatives or friends or anyone that's like, oh my God, what do I need to do? Guys, direct them to me if you need to. Direct them to bpcc.edu. We are registering for both summer Maymester and summer classes and for the fall as well. So the fall registration opened up today. So if you know anybody, make sure you spread the word and everybody's aware that registration is open. Most of the classes so far in the summer are going to be online. I don't know if that may change after the 1st of May for some of the later summer sessions or not, but right now it looks as though most of those classes will probably be online, but there's a lot out there being offered. So what I'm hoping for you guys is that you will be able in Intro to Phlebotomy that maybe we'll be able, and we'll let you know way in advance so that you can plan accordingly. If we're able to, not only are we still going to have our clinical meeting as it stands right now, and I'm going to send out an email to you guys, it's going to be May the 11th like it always was, okay? And hopefully we can do it face-to-face on campus with Miss Spearman. The only change may come is the time. If you will notice in information that's been given out to you when we were actually still in class, the May the 11th, which is a Monday's clinical meeting for anyone potentially being able to go to clinicals in the fall, that meeting was supposed to start around 1 o'clock. But because we missed our luncheon, and part of the thing that we would have done in our luncheon was after we had lunch together and the classes in clinicals now would have been able to talk to you guys that are going into clinicals. Other than that not being able to happen because of COVID-19, right after that, you guys would have stayed after lunch and you would have filled out your VA paperwork. It is vital paperwork that has to be filled out prior to you being able to do your clinical rotation at the VA. So unfortunately, that's going to be pushed onto this meeting. Now, this meeting already had paperwork and things that needed to be done at this meeting. So now we're going to have the added work of having to do the VA paperwork at the same time, and it's rather lengthy. So that the only difference on that May the 11th meeting at this time we're looking at, and this is not set in stone yet, is that meeting may occur at 9 or 10 in the morning on that Monday, May the 11th, versus 1 o'clock. We will make that decision in the next couple of days and get that information to you ASAP, okay? And I know that this is hard on all of us, but we are doing all we can to stay on track to make sure that you guys are able to finish your lab properly and be able to go in the fall to your clinical sites. So what else I'm hoping that'll happen in sometime in maybe June or July is that we will have a lab boot camp for Intro to Phlebotomy, that we will get you those dates and times way ahead of time so that you can plan accordingly, but so that you can come onto campus and we can practice some venipuncture, skin puncture. You didn't get the practice that you really needed to be as successful as humanly possible in Allied Health 211. I want y'all to be so good when you walk into those clinical sites that you impress them and they all want to hire you. Well, the only way we're going to be able to do that is to get in some more practice. So I'm really, really hoping we'll be able to do that for two reasons. Not only does that make sure we finish out our lab so that you guys don't have to take an eye and get pushed back on your clinicals, but also because practicing this makes you really good at it. It takes away the nerves, and it makes you more impressive to your clinical sites and a better phlebotomist all the way around in the end. Okay? So to help us stay on track, what we're going to do is keep trying to go through these lab worksheets. You guys to look at this stuff, remember it, go through it over in your head, practice, you know, like I used to tell you, go home and just still keep practicing tying your tourniquet. Practice as much of this stuff at home as you can, okay? But as you know, in your workbooks pages, you have our next workbook sheets would have been for chapters 9 and 10, and would have been for labs 17 through 20. So now this is a skin puncture review, and obviously it's showing you where on the infant's heel we stick. And remember, 1-year-old and younger, we do the lateral part of the heel, and then with our hand, we like to use a non-dominant hand, and we only use fingers 3 and 4, and we went over why. Now the things that are in red that you see on this slide are the most important parts, okay? But I want y'all to practice this. These are things that you can do at home in place of when you would have been in class in lab. Go over this, repeat it out loud to yourself, all the way from the fact that warming a hand gives you 7 times more blood, all the way down to tell them to remove the Band-Aid after 15 minutes if it stopped bleeding, and always be polite and show great customer service and tell them thank you. And that we also then label our specimens with the basic 6. And remember, practice your basic 6 so you will remember what that is, right? Okay? So you can pause this slide. You can turn in your worksheets to a lot of these same things and go over it. Remember all those things I told you. They aren't just there. Number 1, wash hands and select appropriate barrier and PPE. Don lab coats. You know, have your closed-toe shoes, your gloves, and your marker, right? Mark off that you're doing that. You know, cleanse your work area, right? And that you recognize the implications for failure to comply with CDC regulations about cleaning your work area. And nothing is more hitting home to us on this than this COVID-19 issue. This is a deadly novel virus that is killing a lot of us, and it can stay on these surfaces for long days. It's easily spread from human to human, and things like hand washing, wearing your appropriate PPE, and using your 10% Clorox to clean your area is vitally important. And this is just showing you why I used to go over that so much, why this is so important, okay? So make sure you stop this slide, go over these, and make sure you know every one of these things, point by point, what you're supposed to do. So if we were in lab, we would be going over 17A, which would be collection of blood for a differential blood smear and into a micro container, okay? And this would be an example of a requisition form that we would have, right? And the patient's information would already be entered on there. And you would sit there and take the time to fill out your patient rec with all your patient's information, right? And what tube are we using, right? Okay, so what's been ordered here? We have a CBC with a Diff and a hemoglobin A1C, okay? So our specimen source is going to be capillary, right? And we would write that in there. And we would always want to know what our specimen source is on our requisition, because as we know, capillary blood has a different makeup than venous blood, also arterial blood, and we want the physician to be aware of what source this specimen is coming from. So if he sees some differences in results, the explanation could be in the fact that it's capillary blood versus venous blood, right? Okay? So this requisition is vitally important to us because it not only tells us what the doctor has ordered, so we will know which container we need to collect it in, or what we need to collect and how much we need to collect, but it also gives us the information on our patient, what room they're in, okay? What's their name, what's their date of birth, because as I say over and over again, the most important job you have as a phlebotomist is to make sure that you properly identify your patient prior to collecting their blood. And the second part to that is we never label any specimen until after it's been collected, and then we make sure it's labeled properly, because that goes all into making sure you ID your patient properly so that we don't put out results on the wrong patient or give that wrong patient medicine or blood based on those results, okay? So we all know that we greet our patient, we introduce ourselves, we tell them where we're from, we tell them what we're there for, right? And then we get them to tell us their full name and their date of birth. We check it against our requisition form to make sure everything is spot on correct. Every I is dotted, every T is crossed, it matches perfectly. If something on that requisition does not match that patient, you must stop that immediately and go check with your supervisor or with a nurse or someone to correct that information or to make any adjustments that needs to be made to make sure you are drawing the right blood on the right person, okay? So we know for a CBC, we're going to do a purple micro container, right? Also for the hemoglobin A1C, right? A purple micro container, okay? And then we're going to make slides, and you have to have 2 slides, okay, for that one patient. So on this patient, we would collect a purple micro container, and we would make 2 slides, and the slides would have to be, they would have to go from thick to thin, have a nice feathered edge to them, and they cover about 2/3 of the slide, okay? And then we label our slides appropriately. Okay, if we were in class, we would get some bonus points for doing some more, and we would look at all this, but this is the main thing. And we remember that our barcodes, our labels that have barcodes on them go on the specimen, and our labels that doesn't have barcodes on them go on our specimen log that is kept in our lab. So make sure you pause this slide, read over it, practice what you would do and what you would fill out. Make sure you're really familiar with this stuff. And here is a picture there over to your right that shows a really nice slide. That's a frosted edge slide. That frosted end is where you would write your patient, would write down your patient identification, including your initials, the patient's name, and the date that you collected this blood and made this slide. And as you can see there on that picture, they put 1 small drop of blood either from a purple top tube or from a finger, right? And then you would take a second slide, put that slide on there, and we'll have some slides that show that. Come back into it as it starts to move across that pusher slide. Then you push that slide smoothly and evenly across, and it spreads that out. And you have that nice, if you can see it, that nice feathered edge down there at the bottom. And as if you'll notice, the area right down here is thicker, okay? And as you move that pusher slide forward, this thins out, and then there is your feathered edge, okay? So make sure you pause this, okay? And that you read over it, okay? And you understand everything that's on here, okay? If you have any questions about this, or if any of this is confusing, make sure you reach out to me, okay? So that differential count, or Diff, what they do is the lab techs count the first 100 white blood cells encountered on that stained blood smear. And we stain it so that we can differentiate between each of the 5 different white cells. And we have a little counter, and we'll get more into that. And the first 100 cells, they count on this smear, and then they do a percentage of that, okay? So here's a picture of what it looks like. You'll have those 2 glass slides to practice with, right? And if you'll notice here, you're going to place that second spreader slide flat at the top of the first slide, okay? And see how up at the top, up here at this top photo, you can see where the blood is back here, the drop of blood, and the pusher slide is up here, because you're going to take that pusher slide and you're going to bring it back, as you'll see in this slide right here, okay? And then you see the blood running across there, right? And then we move it out, and that's what our slide looks like, okay? So again, make sure that you look at these, and it kind of gives you an idea of what you're doing here, okay? And you see that the sliders, the spreader slide, is usually, you try to get it at about that 30 to 40 degree angle, okay? Because the angle is very important in making the slide. So things that we do and do not want to do. As you see right there in that picture over to your right at the top of the 3 slides with the 3 drops of blood, people do that. It's a no-no. You do not put several drops, then go back and spread them one at a time, because by the time you get to the second one, and especially by the time you get to that second slide, that drop of blood a lot of times has dried out, which means that some of the cells may not have started to clump up with the platelets, and you may not get a correct reading when you go to do that differential. So you never do it. You do put 1 drop on it, take your spreader slide, spread it out, sit it in your dirty pile, right? Take our second clean spreader, then drop your second drop of blood on your second slide. Then you take your clean second spreader slide, spread it out, right? And then you let them dry when you finish up with your patient. Blood smears are normally made from the finger, not a microtainer. But you can use a dropper on a wide mouth microcontainer and make the slides. They also make this nice little device that you can put into a purple top tube, and it's white. It is in your textbook as well, picture of in there. You could turn that tube over, push down, and it without ever having to open up that tube, take that top off of it, because taking the top off of that purple or lavender top tube to get a drop of blood out is increasing the risk of vapors coming out of that tube, of blood splatter, and infecting you possibly. So this little nice device really helps being able to get a drop of blood out of that purple top tube to make a blood smear without taking the top off, which lessens the chance that anybody could get blood on them, that's our top priority, right? Okay, so, and remember, on the slide, and you see that bottom slide down there, on your right-hand side, you put the patient's full name, today's date, or the date that you did that slide, and your initials as the person who did it, okay? So this one is talking about making malaria blood smears, okay? Again, here's our requisition, and if you see, the doctor ordered malaria, okay? Our specimen's going to be capillary because we were going to make our slide from a finger stick. You know, you want to know that you take this to what section of the lab? Hematology, right? Okay, is this a part of the CBC? No, malaria is not normally part of a CBC, right? So we want to put a check mark. We did this, remember, so that everybody would get used to understanding that the barcoded label is the one that goes on the specimen, and the label without a barcode on it goes our specimen log, right? So we want to make sure we remember that. We want to make sure the importance of matching up the information that is on our requisition form to our patient and make sure they all match up perfectly, because the #1 job you have as a phlebotomist is to properly identify your patient, okay? So this would be our requisition. It would already, of course, the patient info would already be filled out on here for you to be able to ID your patient, okay? So malaria blood smears, okay? These are typically ordered when the doctor suspects that a patient of having the parasite that causes malaria. The parasites live inside those RBCs. We have those regions that are endemic or epidemic for malaria, like Africa, Korea, Vietnam, and the South Pacific, more warmer climates, right? And these are Plasmodium vivax and ovum. These are our 4 possible species of the parasite that causes malaria. it's important that not only do we know if they have malaria, but it's important when we're treating them and understanding the progression of the disease or progression of the parasite making the patient sick, which plasmodium or which parasite of the do they have, okay? So we need to know that as well. So since we do not live in an area that's epidemic for malaria, why do you think you need to know how to do this test? Because we have the Barksdale Air Force Base, right? And our servicemen and their family travel to these areas. There's also could be, we have a big oil and gas economy here in Louisiana. A lot of times they travel to foreign countries in the business that they do, and they come back. We have a lot of business owners and people who work. Maybe they're not in the military any longer, but they contract with the military, and they may travel overseas. So we want to make sure that we're able to do this, because this is something you come in contact when you're working in the hospital. Okay, so moving on, the malaria blood smear. So when you're making or collecting blood for the malaria blood smear, you have 2 smears are made. This is important on your next test and on your final. So make sure you understand this, okay? So remember, when you're collecting blood for a malaria blood smear, you make 2 smears. A thick smear. The thick smear is for them to look under it, and they are going to see if malaria is present at all. They're looking for that ruby red ring of that parasite that is housed inside that RBC. If we don't see that at all anywhere on this slide, then we don't necessarily need to move to the thin slide. Now, this thin slide is once we see that they do have the malaria organism present in their blood, then we look at the thin smear so that we can decide which one of those 4 species we talked about earlier is present, and they can note that so that the doctor will not only know they have malaria, but what specific one they have, so they'll know the course of treatment. So if we were in class, we'd turn all this stuff in, and this would have been how you got your points, but I've been putting up some stuff for you guys, and I'll put up another video either tomorrow. Most likely I'll have that video up on Friday along with the video for these slides, showing you examples of how to visually make these slides and how to make the malaria ones. And hopefully, like I said, sometime in June or July, we can get back onto campus and we can do a boot camp, and you guys will have the chance to make these slides in the classroom. But make sure you pause this and go over this stuff and you understand it, okay? Now, and before we leave, we always dispose of our waste properly. We think before we toss. We always make sure that we're putting that trash, and if it has blood or body fluids on it, it always goes in the biohazard cans. But we also want to think. We don't want to throw things in the biohazard that don't need to be there. If it doesn't have blood or body fluids in it, it needs to go in the regular trash. If it's a sharps, it needs to go into the sharps container. And if it's broken glass with no blood or body fluid on it, it just needs to go into the broken glass container. And remember, we always want to put our lab coats up, remove our gloves properly, and toss them properly, and to make sure that we sanitize our hands and the area we worked on. Guys, pull out your white lab binder. Go through these labs. They're in there. Look over them. Look over these slides and start studying chapters 9 and 10. Fill out the study guides at the back so that you'll be ready to take your next lab quiz. And your next lab quiz will be on chapters 9 and 10. So start filling out those study guides. At the back of these chapters, I'll post the videos for the labs 17 through 20. You'll have everything you need to study. Get started now. I hope everybody's doing well, and I hope to see you guys soon. Make sure you're checking your emails, and make sure you're checking for the videos. Have a great day.